is back.
Yeah, where? This back?
This is forward, backwards, and laser pointer.
This is first?
Forward is the right one.
Okay. Good morning, ladies and gentlemen. And I'm very happy to be here and explain something. This time, I'm not to talk the research like last time I talked in SMS. But this time I more talk about some specific cases and the miracle of Chinese medicine and how to treat gynecologic difficult diseases, okay? And what is the miracle? This is patient said, it's not by me. The patient said, oh, I'm a miracle. I don't believe I can be pregnant just with the Chinese medicine. And after I experienced so many difficult and different kind of treatment, that's the patient said, all of them, okay. So what is the miracle? Is something seems unbelievable things and extraordinary things, it happened. Okay, and what kind of a miracle today? We will, of course, this meeting will be about infertility, so we also talk something around infertility due to like, can be PCOS, can be like repeated implantation failure, or some adenomyosis is according to the time. So I will try to quickly to speak. In fact, these need at least 2 hours, but I shortened them, very short, very short. Okay, first, oh, he's more clear, my God. Here, first, PCOS, okay, this we don't need. And TCM, okay. And if with this, I have to change my ticket, change my class, sorry. Okay, it's better for me because I had a spondylosis. I don't want to like my neck too much turned. Maybe I will have the dizziness, so better look here. Sorry for that. Okay, so now we are better. Okay, the first case. This is a 28 years old lady and came to see me 2016. He want to have a child for 3 years. The most very important problem is they don't have the period very much. Infrequent, every 3 to 6 months they had one period. And recent few years, there's no period, only by progesterone taking, okay? So, it's too much. And she, in the Western hospital, she had done 35 glucophage, this metformin, and the treatment. And even she had clomiphene tried to push the ovulation, but there's no reaction to that. And the diagnosis from Western point of view is primary infertility, oligomenorrhea, and the PCOS, diabetes, she had diabetes, okay, and the clomiphene resistance, okay. And, oh, where is the tongue? Oh, we should back. No? And why is this? You said back?
Back is this one.
Back is, but we don't, but there's no tongue, should be before, there's a tongue. Where's the tongue? This is the...
No, that's the wrong.
Not wrong?
Here is forward.
Forward? No, there is so much, my God. It's, oh, it's not this one. It should continue. Why is it not like ordinary? Even can I control from here?
What, you can go here.
Yes, that's easier. Okay, course report, and today good. Okay, so sorry, there always something happened. And so, oh, Sorry, I didn't know why the tongue disappeared, but anyway, maybe the tongue will come in. Okay, the tongue is a swollen, tender, dark and red, and most coating is foliated. And so her diagnosis will be yin deficiency with empty heat, with blood stasis. So we gave the treatment, replenish kidney yin, and clear heat, nourish and activate blood. And mostly, you have to, every time you have to do the modification because we don't have time to talk in really. Oh. Did you use the new one? The last one? This is the before, this is longer. You use the new one. It's not a new one.
Which one is the right one?
This is the new. Let's
This
see.
one?
The before?
This?
Yes, this one.
Sorry.
I will talk 2 hours, my God. I will stay for a long time, sorry for that.
Sorry.
Thanks a lot. Okay. Now you from beginning? Okay, I go. Oh, go like this, I can go quickly, okay. Good. My God. Okay, now the tongue is coming. But you know, the problem is we didn't give, at the beginning, the tongue. This is the first one. This one is from the middle. You have already treated several months, okay? And the last one is just before pregnancy, okay? So we can see the tongue is most coating as for before is red, and also can we make a point to like point? To point? They're like laser or something? Oh,
No,
this.
you have to
Yeah,
point.
yes, that's
You
good.
don't see it on the finger.
Nothing to see. You
Just
cannot see very
the
clear.
laser pointer you can show.
Okay, so anyway, there's some red. Before all of this is red without coating, okay? Now it's getting better and better like this. But anyway, this is typical yin deficiency, okay? And the tongue diagnosis we said many times, and the treatment principle. Okay, so after treatment, her period came every 35 to 42 days, so that's wonderful. Before it's very difficult to have one. And even she started to have ovulation. Okay, at the 3rd month of ovulation, she became pregnant and get a very healthy boy, so very nice. And another case like repeated implantation failure, okay? And the case with 41 years old. He came to my clinic in 2015, and she have already had several times IVF embryo transfer, but the last 3 she failed. Okay, and although they didn't find some reason, she was a little bit sad because her condition is not that very good, and her period delayed, and the hysterosalpingogram showed right side the fallopian tube is blocked. Left side is not completely open, so there's very low chances to get naturally pregnant. And her anti-Muller hormone is lower, you can see. And she was sad, and she just wanted to get some Chinese help. Maybe next IVF will be successful, okay? And the TCM, Western diagnosis will be secondary infertility and repeated implantation failure and delayed cycle, and sorry, too quick. And diminished ovarian reserve, and the right tube blocked, we have already said. Only left incompletely open, so it's a little bit difficult. This is the tongue. We can see this tongue is swollen, darker, with many ecchymoses. Can you see it clear? Oh, they said this point, this one is a point, right? This?
This one here.
This,
yeah.
Okay. Oh, no, it doesn't can see. Okay, sorry, don't waste time. Okay, so we can see And the tip seems a little bit red, less coating, but on the back, very thick. And the coating also dry, have already damaged in. So that's the cases. So the tongue, you see very clear, swollen and dark, and the coating thick gray to yellow, and with multiple petechia, okay. And the pulse is thin and very so. And the syndrome, blood stasis, definitely. You see around the tip of the tongue very clear. Okay, maybe here picture not so good because it's too light. And the blood stasis and the damp heat with kidney deficiency. So we have to active blood stasis and clear damp heat. That's very important. Why I didn't mention the first step, the replenish kidney, because too much sick of the coating. First we have to root out a little bit of pathogenic factor. That's very important. And then we put more strength to replenish the kidney, okay, for the ovarian function. That's very important. And then that lady, she finished all tests in Western Medicine Hospital and decided to have another controlled ovarian stimulation for IVF. And then she found that she's pregnant, naturally pregnant. But we have to, with the Chinese medicine, help until 16 weeks. And she had a very big, healthy boy, okay, very big. And next, we will talk about recurrent endometriosis with 2 chocolate cysts. And this lady, although is still young, but the problem, she had surgery, and she is 32 years old and infertility for 6 years. She had a laparoscopy and take out the left chocolate cyst, only half year. The pain come back and the cyst come back, a very bad condition. Later, she tried different kind of Western medicine treatment, and no gestation happened, no pregnancy. And the doctor said, you have to do another laparoscopy for your recurrent chocolate cysts. Okay, she doesn't happy with that, and she come to see us in 2012. And that lady, sorry, what's happening? It's okay. We can see through the ultrasound, and the right chocolate cyst is nearly 7 centimeters, and the left was more than 5. So the 2 big cysts, that's the reason doctor wants to do the surgery again. But they do the surgery is okay, but you will lose more follicle from the ovary, and even the ovarian function will reduce the more. And yeah, nothing.